If you choose to be induced at a hospital, there's a very good chance that you will never truly receive informed consent. One of the drugs that is used for induction, if your cervix has not started to change very much on its own, is called Cytotec. So today, I want to talk to you about Cytotec. That's it. That's the intro. Let's go. It's review time, one of my favorite times. Today's review is short and sweet and to the point. It's from Karate Girl 24, left back in October. The headline says, "The best." It says, "I love this podcast and I'm so thankful to Lori for sharing all her wisdom with us. I leave every podcast feeling informed and empowered." Thank you so much, Karate Girl. That encourages me so much. I'm so glad that you're getting good information from this. And I hope that all of you listening are. I hope that you are sharing this with your friends and your family who are needing some good information for their pregnancies as well. If you haven't already, please go to Apple Podcasts and leave me a quick 5-star written review. It helps me so much. You just don't even know. It doesn't cost you a thing. Only takes about 30 seconds, and it helps me reach more moms just like you who need this content. Now, before we get into the main content of our day, I got a special little note, a special favor to ask of you guys. So I asked for 30 seconds for the review. I also have another 30 seconds to ask of you today. Our dear Dr. Stu Fishbein, he was on the last 3 episodes of this podcast, has been nominated to potentially be a part of the Make America Healthy Again movement that RFK Jr. is leading. How exciting is that? How awesome would it be to have someone like that informing the cabinet of the president? I'm so excited. But here's the thing, he needs our support. I don't even know if he fully understands what has to happen or if it's like a voting process to where only the top one gets to go. He didn't seem to know when I talked to him. That's fine. Who cares? We're going to vote for him anyway. I want you to go down to the description and find the link. I'm going to put it down there. You'll have to make a quick account. I think it maybe took me a minute to do the whole thing. So you go, you make your account, and then it's going to have a little vote button at the top. Click that. That's all it is. You can leave a comment if you want to, but you don't have to. You can just vote and be done. He gives and he gives and he gives to us. So let's all go give him a quick vote, because in the end, if someone like him gets into a powerful position, just think of what that could do for maternal health in our country. It would be huge. Huge. Yeah, I did that. Okay, go do that. Links down in the description. Now, on to our topic for today. As much as I would love to know that none of you listening to my voice right now would ever consent to an unnecessary induction, I know the reality is that some of you will. You'll be pressured to, or maybe you'll just get scared and do it, whatever the reason. I decided because of that today we're going to talk about Cytotec. And maybe in the future we might talk about some of these other drugs that are commonly used. Cytotec is often used to induce labor, and sometimes it's used postpartum as well for hemorrhage. So I want to help you understand about this drug and to understand the risks. And the risks of this drug are significant. Okay? If you want to learn more about this topic that I'm going to share with you here today, I encourage you to get a book called Born in the USA. I had it right here. Oh, it's in my lap. Born in the USA. If you're watching on YouTube, you can see the cover. I've got all kinds of little flags and things highlighted. It is called Born in the USA, How a Broken Maternity System Must Be Fixed to Put Women and Children First. This is one of the first books that I read about the reality of our maternity system. It was written in 2006. And I will tell you, it is disturbing. So you might not want to read it if you're pregnant right now. I used to say if you're pregnant, don't read it. Wait till you're not pregnant. But now I'll say that you might need to. There are some scary stories in there, but the stories are true. And you might need to hear them to realize the reality. So you'll have to decide whether you need to read it or not. But it's a great book. It is well researched. There's tons of references. I'm going to read something out of it here shortly. But this is something you might want to have on your bookshelf if you want to really, really understand the maternity system. Okay? Again, I'm going to put a link down in the description so you can find it. Go check it out if you want to. Now, what I want to do first is I'm just going to read to you from the drug insert. This drug is made by Pfizer, and you can access this information I'm going to read to you on the FDA website. I put the link for that below as well. Okay? This is the very first thing on the page. First of all, the brand name is Cytotec. The generic name is Misoprostol. People say it different ways. I always called it Misoprostol. Warnings, okay? This is before they even get into the description of the drug. There's a huge warning box, okay? Cytotec, or Misoprostol, administration to women who are pregnant can cause birth defects, abortion, premature birth, or uterine rupture. That's how they started off, okay? Now, let's talk about that a little bit more. Let's qualify it and get some context. Uterine rupture has been reported when Cytotec was administered in pregnant women to induce labor or to induce abortion. Okay, so this is something that some people will use for moms who are trying to have an abortion, but it's also used in inductions for much the same reasons as you'll hear in a little bit. And by the way, not only is this in a warning box, it is in caps. Okay, they are serious. They want you to see this. All right. The risk of uterine rupture increases with advancing gestational ages and with prior uterine surgery, including cesarean delivery. Okay, so the further you get along in pregnancy, and if you've had a C-section before. When is Cytotec usually used? People who need to be induced according to the medical model, who are going to be further along in their gestational age. Okay. Let's skip ahead to a couple pages. I'm not going to go through all the description and the pharmacology and all that. If you want to read that, feel free to go check it out. It's a little bit beyond what you need here because in that section, it's actually talking about why the drug was created. Because by the way, using it in any way in maternity care is off-label. You'll recall about 4 years ago when drugs were used off-label. Do you remember what an uproar came from that? If not, go back and look it up. There were certain drugs that, oh no, we can't give those. That's off label. And yet, every day in maternity systems and maternity care wards, this drug is used off label. There is no indication for it to be used in pregnancy. There's not an indication for it according to the manufacturer. Okay. Now, the manufacturer does address that it is frequently used for maternity care, but it's off label. Okay. Skipping down to the indications and usage section. Cytotec or Misoprostol is indicated for reducing the risk of NSAID, which is non-steroidal anti-inflammatory drugs, including aspirin. NSAID-induced gastric ulcers in patients at high risk of complication from gastric ulcer. So that's why this drug was created. That's what this drug is indicated for. Period. Okay? Just want to throw that out there. That's what it's for. Now, we're going to skip forward a little bit more. All right? Got some good story time coming up. Hang in there. In bold, and all caps, special note for pregnant women. Cytotec may cause birth defects, abortion, sometimes incomplete, which means that the abortion starts, but it doesn't finish. Premature labor or rupture of the uterus if given to pregnant women. Prostaglandins, such as Cytotec, may augment the activity of oxytocic agents, which that's Pitocin, by the way, especially when given less than 4 hours prior to initiating oxytocin treatment. Concomitant use is not recommended. By the way, it is very common to start Pitocin after giving Cytotec. Happens all the time. It may or may not be after that 4-hour window. I can't speak for each practice. I'm just telling you, it happens because I've done it before. Okay? Skipping forward. I'm just reading to you the information that is on the drug insert. The information that they're not going to tell you at the hospital because they don't give you truly informed consent. They don't read these things to you. Okay? We are in the section under pregnancy. Okay? Cytotec may endanger pregnancy, may cause abortion, and thereby cause harm to the fetus when administered to a pregnant woman. I want to stop real quick and say the reason this works for abortion and for induction is because what it's doing, what they found it did as they gave it to pregnant women for ulcers, is that it opens the cervix, okay, which sounds like it comes in pretty handy, right, if you're trying to induce a labor. But as a result, they found out that it does these things. That's where it all came from. You can read more about that in the Born in the USA book. So it causes harm to, or thereby Cytotec may endanger pregnancy and thereby cause harm to the fetus when administered to a pregnant woman. Cytotec may induce uterine contractions, uterine bleeding, and expulsion of the products of conception. That means the baby and the placenta. Abortions caused by Cytotec may be incomplete. Again, it starts the process, but it doesn't finish it. So the baby can survive it or maybe be injured. Just leave that there. All right, next section, labor and delivery. There's more here, okay? Cytotec can induce or augment uterine contractions. Vaginal administration of Cytotec outside of its approved indication has been used as a cervical ripening agent for the induction of labor and for treatment of serious postpartum hemorrhage in the presence of uterine atony. Uterine atony means that the uterus is not clamping down like it should after the baby's been born. A major adverse effect of the obstetrical use of Cytotec is uterine tachysystole. That means basically it's continuing to contract over and over and over without any rest in between, which may progress to uterine tetany, which is just kind of like a constant contraction that just seizes up and won't stop, with marked impairment of uteroplacental blood flow, which is the blood flow from the uterus to the placenta and back, okay? So it's blocking or it's impairing the blood flow from the placenta to the uterus, which is the baby's blood flow, okay? With marked impairment of uteroplacental blood flow, uterine rupture requiring surgical repair, hysterectomy, and or salpingo-oophorectomy, which means removal. Basically, it's a hysterectomy with removal of your ovaries, or amniotic fluid embolism and lead to adverse fetal heart changes. Amniotic fluid embolism is almost always fatal for the mom. Also the baby, if the baby's still inside. It is basically a large bolus of amniotic fluid getting into the blood circulation, which you can't live with. And it causes the mom to go into shock and eventually die. Big deal. Uterine activity and fetal status should be monitored by trained obstetrical personnel in a hospital setting. And yeah, that's true. You should never, ever, 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 ever use Cytotec without monitoring. However, monitoring won't prevent these things from happening. It'll just let you know that they have happened. Okay, continuing on. The risk of uterine rupture associated with misoprostol use in pregnancy increases with advancing gestational ages and prior uterine surgery, including cesarean delivery, grand multiparity, that means you've had a whole lot of babies. Grand multiparity also appears to be a risk factor for uterine rupture. So that means basically you've had a lot of babies, your uterus is more stretched out, not as elastic, and so it tends to cause this more for people who've had a lot of babies. The use of Cytotec outside of its approved indication may also be associated with meconium passage. That means the baby has its first bowel movement while still inside. It's not always awful, but it can cause problems. Meconium staining of the amniotic fluid, that's basically the same thing, and cesarean delivery. Maternal shock, maternal death, fetal bradycardia, and fetal death have also been reported with the use of misoprostol. Cytotec should not be used in the third trimester in women with a history of cesarean section or major uterine surgery because of an increased risk of uterine rupture. Cytotec should not be used in cases where uterotonic drugs are generally contraindicated. Uterotonic drugs like Pitocin and that kind of thing, contraindicated means you shouldn't get it. Or where hyperstimulation of the uterus is considered inappropriate, such as cephalopelvic disproportion, which means they have determined that the baby's head is too big for the pelvis. That's not really something that is, quote, real when the mom's up laboring as she should be, but I digress. We won't go into that fully here. grand multiparity, hypertonic or hyperactive uterine patterns, or fetal distress where delivery is not imminent or when surgical intervention is more appropriate. The effect of Cytotec on later growth, development, and functional maturation of the child when Cytotec is used for cervical ripening or induction of labor has not been established. Information on Cytotec's effect on the need for forceps delivery or other intervention is unknown. The use of Cytotec for the management of postpartum hemorrhage has been associated with reports of high fevers greater than 104 degrees Fahrenheit, accompanied by autonomic and central nervous system effects such as tachycardia, disorientation, agitation, and convulsions. These fevers were transient in nature. Supportive therapy should be dictated by the patient's clinical presentation. By the way, if you spike a fever like that right after you've given birth, not only are you going to get lots of interventions, so is your baby, because they're going to go ahead and assume that your baby has been exposed to whatever it is that's making you have that fever, and almost never do they suspect it's coming from Cytotec. They think you have an infection, okay? So just keep that in mind. You're opening yourself up to a world of intervention, probably NICU admissions, all kinds of things. And that's assuming the worst doesn't happen. For nursing mothers, misoprostol is rapidly metabolized in the mother to misoprostol acid, which is biologically active and is excreted in breast milk. There are no published reports of adverse effects of misoprostol in breastfeeding infants of mothers taking misoprostol. Caution should be exercised when misoprostol is administered to a nursing woman. Let that sink in. One last thing on the drug insert. How is the drug supplied? It is supplied in either 100 microgram tablets or 200 microgram tablets, okay? But the dosage for giving Cytotec vaginally is 25 micrograms, but it's not supplied in 25 microgram tablets. By the way, the reason that Cytotec is very often used is because it is cheap, okay? It is very cheap, but it's not usually scored. And even if it is scored, it's only going to be scored once, not twice. And to break a 100 microgram tablet into a 25 microgram dose, you have to split it twice. You have to split it into quarters. It doesn't split evenly. And so the dosage is never accurate. You never know for sure exactly how many micrograms you have. That's another problem. So let's talk about, is it ever okay? Like, what are the indications when it might be okay? It may be indicated for postpartum hemorrhage. That's the only time I would ever give it at this point in my career. But I personally would never, ever, ever consent. Me personally, I would never let anyone give me Cytotec for induction. It's just not worth the risk. I'm going to talk about numbers in a minute. For one thing, if they're offering you Cytotec, it means your body is not ready to be in labor, because it's only given when your cervix is still relatively closed and relatively thick, because once it's open, it's not considered needed anymore. It's a cervical ripening agent, meaning it's starting to get your cervix ready to open up. If your cervix has already started to open up, it doesn't need to get ready. So that is a sign that it's too early for you and you don't really need to be induced anyway. For another thing, it sets you up for catastrophic risk. These are not small risks. Catastrophic risk for what? To just get pregnancy over with? To hurry up and have a baby so the doctor can go home earlier? Is it worth it? I just don't think it is. The best thing is just to wait for labor. But if you have an actual, real medical indication, and by the way, most of you do not. Most of you do not have a reason to actually be induced. There's a very small percentage of women that actually ever even need to be induced. But if you're one of those people that actually does need an induction, there are ways to soften soften the cervix more naturally without this immense risk that this drug carries. If I was a VBAC mom, meaning I'm trying to have a vaginal birth after I've had a C-section, there is no way I would let Cytotec enter my body. probably even postpartum, because there still is that scar there and you still could have issues. But you can weigh it postpartum, because at least postpartum, if it's stopping catastrophic hemorrhage, then it might be worth the risk to keep you from losing your uterus. That's kind of one of these, that everything has risk. You have to decide what risk is worth it. The risk doesn't go away postpartum. It's just that sometimes it's a better option to take that risk than others. That's how I look at it. Okay. By the way, the other ways to potentially soften the cervix naturally are very simple and very free, for that matter. Having sex, that softens the cervix. Sperm is a prostaglandin, which is also what Cytotec is and a lot of other things that we use. And prostaglandins soften the cervix. Okay, you can also use things like evening primrose oil or borage oil capsules, and they can help soften the cervix. There's other ways to do this without exposing yourself to a drug that has warning after warning after warning on the drug insert. Okay, I want to read to you the statistics in the Born in the USA book. Okay, there's a lot of excerpts I almost read to you, but for those of you who are pregnant right now, I don't want to scare you to death. I'm going to give you the option to go read it. There's stories of patients who were given Cytotec and the things that happened to them. But what I'm going to read to you is on page 80 of Born in the USA. The table is entitled Cytotec Induction in the United States from 1994 to 1999. I'm not going to go through all of the numbers, but I will say that over that 5-year period, more than 500,000 women had a Cytotec induction. More than 10,000 women had a VBAC Cytotec induction. By the way, the use of Cytotec in women who are trying to have a vaginal birth after they've had a C-section is a large part of the reason why VBACs are not allowed in a lot of places now, because they did cause a lot of uterine ruptures, but they never took the time to look at why they were being caused. They didn't even look at the fact that, oh, it's Cytotec that did it, not the prior C-section all by itself. And to this day, there are places that the reason that they cite that there is this great risk of rupture, but it's based on the fact that these women were given Cytotec. It's so unethical. So more than 10,000 women had VBAC Cytotec induction in those 5 years. More than 500 women with VBAC Cytotec induction had uterine rupture. More than 100 women with VBAC Cytotec induction and uterine rupture had dead babies. An unknown but significant number of Cytotec inductions resulted in hyperstimulation of the uterus or rupture, leading to brain damage in the baby. An unknown but significant number, more than 20, of Cytotec inductions resulted in the woman's death. And that the sources of this are from the CDC and from ACOG and a couple of papers. And if you get the book, you'll be able to see the sources there. All that to say, why? There are better ways. First of all, waiting on God is a really good way, because if you're not in, there's one way to know if your body's ready to be in labor. One surefire way. Are you in labor? Because if you're not, it's not time yet. That's simple. God put the baby in there. God has done every step of creating that baby along the way. Every cell, every organ, everything in that baby. God has seen fit and saw to it that it was formed. So why is it that we think that we have to evict these babies before God says it's time? It's beyond me. It doesn't make any sense. But now that you know the truth about this drug, this is at least one intervention that you now have the full information to make a good decision for yourself. If you want to learn more, if you want to learn about all the different drugs and all the different interventions and all the different things that they want to do to you in this maternity system that we find ourselves in, please go sign up for my course, because we go through all of it in depth, all in one place. You don't have to chase around and go from this website to that website and try to decide if it's good information. It's all in one place. It's all there for you. You just go to go.yourbirthgodsway.com/CEC, and all the information is there about the course. You sign up right there. It is so thorough. I've had several people now who have taken my course and other courses that you've probably heard of. I won't name them, but big name courses. And they say that my course blows those others out of the water because I'll go through so much content. It's thorough. It's going to go over everything that you need to know to be ready to have your baby. But if there's anything I missed that you need to know about, or if there's anything about your situation you want to learn about, there's also the free Q&A sessions that you get to have as a part of the course, where you can live with me on Zoom or Google Meet, depending on the month. Sometimes it's in different places, but we sit down and you can ask me whatever questions you have, and you can get real answers from a real midwife who has no agenda, who has nothing to lose, don't have a practice or an insurance company to make happy. You can just get the truth. That sounds good. Go check it out. The link to that is in the description as well, along with links to my other courses, all the things that you need. Okay. If you have questions, shoot me an email, Lori@yourbirthgodsway.com. Don't forget to go vote for Dr. Stu, and I'll see you right back here next week.